Anything that is adversely affecting somebody can be trauma. Emotional abuse, domestic violence, having seen somebody who gets killed in your family, having substance abuse in your family, all of these are traumatic events. If we really want to make a difference and we want to better the community and we want to make the community more healthy, we need to address these issues.
A lot of the children and families I work with on a daily basis have suffered trauma, and that trauma affects how they interact with the medical community, how they're able to access everything from transportation to medications to just whether or not they can trust that what the doctor's saying is true.
A lot of the skill that we were taught in my many years of schooling is to deal with that physical injury, and that's where a majority of our effort goes and a majority of our resources. Other things are coming to light to say that the other is likely equally as important. Many of our trauma patients who come in by ambulance and have an injury have also experienced traumatic events.
Trauma-informed care to me means understanding that the patients and the people that you interact with are affected by the trauma and the violence that are in their lives, and it affects everything that they do.
We have an obligation to do no harm, and I think that by not taking into account what occurred in the many years prior to a patient's presentation, that we run the risk that we may not know that we're actually harming them. We definitely do things that may invoke some of those feelings. Medicine is personal, so it comes down to feeling safe and secure and cared for. If patients feel as though they can trust us and that we do look at them as a whole, that they're more apt to take their medicine, to come to clinic, to discuss problems that may be outside of the realm of what it is that they presented for, that really can lead to better well-being and overall health.
That's one of the biggest things with trauma-informed care is taking that step to try to understand, to try to meet them on their level. What happened to you, not what's wrong with you. Asking them what their experiences have been, not just taking at face value the fact that they missed an appointment. Going back and figuring out why and what's going on with them to give them that extra time. We do everything from multiple phone calls ahead of time to sending people into the home to help work with them in their community to just sitting down and talking with them.
Always recognizing that there are things that these individuals had to go through in life that I'm not aware of. But the way I treat them is I'm respectful towards them. I am embracing them. I'm putting my arms around them. I'm hugging them, understanding that they need help. Everybody needs assistance and help in this community. I just think this is an exciting time, and it is the right time where this community, all of us, need to work together to be trauma-informed.
Trauma-informed care matters because it takes us beyond the symptoms and treats the whole person.
Trauma-informed care matters because it does make us a healthier community.
Everyone we meet can make a difference.
You are part of the solution.
Trauma matters, Omaha.